Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 938 new cases of COVID-19. This brings our statewide total to 59,636 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This number includes 4,217 positive cases of COVID-19 in healthcare workers and 12,677 positive cases among residents of 549 long-term care living facilities, which include nursing homes and personal care homes. Tragically, we now have 4,218 patients who have tested positive for COVID-19 who have passed away. To date, all of the deaths have been in adult patients. Since the beginning of this global pandemic, it has been difficult for parents to get their children to the pediatrician for well child visits and immunizations. It is very important for parents to continue with these checkups because of the important vaccines children receive at these visits, especially those required for children to return to school in the fall. Unlike COVID-19, infectious diseases like measles, mumps, whooping cough, chickenpox, polio already have reliable, effective, and safe vaccines. Vaccines are a great way to protect yourself and protect your family from a number of serious, life-threatening diseases. Vaccinations not only protect children, they protect our entire community, especially those with compromised immune systems who cannot get vaccinated. I know parents are concerned about their children's safety when visiting the doctor. Pediatricians and healthcare providers have made changes to the way that they see patients and families to ensure that they are getting the necessary care as the pandemic continues. This includes scheduling well visits and sick visits at different times of the day, separating patients by placing those with sick visits in different areas of the primary care office or another location, and collaborating with other providers in the community to identify even separate locations for providing well visits for children. As a pediatrician myself, I know how important it is for continued health care for children during the pandemic. If you have questions about your child's vaccination schedule or any other health issue during this challenging time, please contact your child's pediatrician or health care provider for more information. Most importantly, we want to ensure that we don't have a secondary health crisis because of a delay in vaccinations. These are very real threats. Last year, during the measles outbreak of 2019, we saw the most cases of measles in the United States over a decade. At the Department of Health, we remain committed to doing everything we can to ensure that we have a healthy Pennsylvania for all, and through this pandemic, and in the future as well. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or as we all know now, the time it takes to sing happy birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Don't touch your face, especially after touching surfaces, and clean surfaces frequently. If you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Dr. Levine. From the Lewistown Sentinel, a local county coroner has asked us why the state hasn't withdrawn those who tested positive for COVID-19 and been cleared under the protocol from a county's number of cases, or at least provided a number of people who have recovered in each county. Is this something that the state will consider doing? Why or why not?
Yes, it is. So it is challenging to determine an exact number of recovered patients, but we realize that this is important to the public, and so our epidemiologists are working on a way to estimate the number of recovered patients in Pennsylvania, and we're hoping to have that sometime next week.
Also from the Sentinel, is there currently any mechanism in place for counties to argue their case for moving to the yellow phase if they feel they meet the standards for doing so? If not, how often are the groups of counties considered for progression to the yellow phase?
Well, as we know, 24 counties moved from red to yellow last Friday, and tomorrow, actually, 13 more counties, mostly located towards the southwest, are going to be moving from red to yellow, and we're looking at our data now about all of the different metrics that we look at and the different modeling that we look at, and we'll be having discussions. In terms of counties that have questions in terms of their status, we are always pleased to discuss with them, and our Department of Intergovernmental Affairs through the Governor's Office and the Department of Health are always pleased to speak with county health officials.
From the Philadelphia Inquirer, in what phase of reopening will pet groomers be able to operate? Some say they don't understand how their services pose a public safety threat, especially if pets are dropped off and no humans are allowed inside except employees. What is the risk of the virus spreading in a pet grooming environment? I'm
going to have to check the FAQs about that specific business, but for any business questions about life in the yellow zone, so to speak, and then eventually in the green zone, we have in-depth information on the governor's website, and I believe on our website as well, about that, and then we'll be having discussions about the green zone starting now into next week.
From the Scranton Times-Tribune, Northeast Pennsylvania has 3 contiguous local counties, Susquehanna, Wayne, and Wyoming, whose thresholds are and have regularly been below the state's guideline. Officials in each are urging the governor to shift to yellow. Why aren't they certain to be on the yellow list? Well,
we are looking at all of that data, those numbers, those metrics, and our modeling as we speak.
From WKOK, CVS just announced that they will be opening drive-through self-swab testing sites in Pennsylvania. What will the criteria be for who is able to get a test?
So we are so pleased that CVS will be doing more testing. We are looking to roll out more testing throughout Pennsylvania. We are prioritizing testing patients who are symptomatic, who have some symptoms. They don't have to be severe symptoms of COVID-19, but I know, for instance, Rite Aid will test asymptomatic people. I don't exactly know CVS's specific criteria. I believe that there's a website to go on to register for testing, maybe a phone call, and then just check with CVS about the criteria for their testing.
From WKOK as well, as we await tomorrow's announcement on the next counties to move to the yellow phase, are you pleased with the results of last week's yellow counties? And have there been any concerning data spikes in those yellow phase counties?
So there have not been specific concerning data spikes, but you have to remember it's been now 6 days since counties went from red to yellow. The average incubation period of the virus is 5 days, but it can be up to 14 days. So we're going to continue to be looking really closely now and in the future at all of the counties, of course, but particularly the counties that go from red to yellow.
From Penn Live, Dr. Levine, do you expect Governor Wolf to announce a new set of counties that will eventually move into the yellow phase this Friday, May 15th? The previous 2 announcements have come on Friday, and we were wondering if the same would continue this week.
Well, we are looking at our data as we speak, and I'll leave it to the governor to determine the pace of the announcements.
From Fox 56, When will you know the criteria for counties to move from yellow to green, and what can we expect?
Well, it's a very important question. We've been asked this several times. Again, it's been 6 days since any counties went from red to yellow, but we are going to start to look at that next week.
Once grade schools reopen, what should happen to school transportation? Buses can hold dozens of students.
Well, I'm going to leave it to the collaboration between our department and, of course, the Pennsylvania Department of Education to discuss what might happen with bus transportation when schools open. Of course, that wouldn't be before the fall.
And then finally, from Fox 56, Department of Health data shows 55% of cases are in women and 44% in men. Is there any significance to those numbers? Are women more likely to contract the virus?
Well, there's some suggestion, but some of the data is contradictory, and it looks actually like men might have more serious cases. But as we've mentioned many, many times, this is actually a novel or new coronavirus. It has only been described in the world for the last maybe 6 months now, and there's much that we need to learn.
From the Altoona Mirror, Hospital and Health System Association of Pennsylvania President Andy Carter said today he's disappointed with the governor's veto of the telemedicine bill, with the governor's not including hospital in his executive order providing immunity from liability for COVID-19 healthcare workers, and in the states offering loans to hospitals rather than pandemic relief that doesn't need to be repaid. Do you have a comment?
No, I will leave comments to those type of issues to the governor.
From the Butler Eagle, there was a spike in deaths today. Your reports on Tuesdays and Wednesdays usually have these due to a lag in reporting. Is the spike for the same reason, or is it indicative of what's happening in counties who are now in the yellow phase?
So this is part of the continued reconciliation process that we talked about. We have really been working very closely with Philadelphia now, very successfully with the Philadelphia County Health Department in terms of reconciling our data on a daily basis. We are still working on reconciling our two data systems, which are very different, the NED system and the electronic death reporting system. So today there were 44 new deaths reported overnight, and the remaining 231 were as a result of that reconciliation, and that's really deaths over the last number of weeks.
From KYW News Radio, Dr. Levine, in your professional opinion, is it safe to plan on attending in-person summer camps this year? Has the state made a decision yet regarding whether summer camps will be open or closed for this summer?
We are working on that now with the governor's office and other departments, and I expect a decision and reports to go out soon.
And how would you propose young children social distance themselves from each other in that environment?
That's part of the guidance that we'll be putting out soon.
From the Tribune Democrat, is the state responding to any local spikes or clusters of cases in the 24 counties that entered the yellow phase on Friday? Because the surge in Lycoming County long-term care facility pushes the county above the 50 cases per 100,000 population metric. Does that threaten to push the county back into the red phase?
So we're aware of the long-term care living facility outbreaks. We're watching them very closely. As I've mentioned, we have many ways to consult with them and to work with them, and that is all occurring. We are aware of the increased cases in Lycoming County, and it will not threaten its status at this time.
From Penn Live, has there been any guidance on future trade shows or conventions taking place in the state this year? These events are planned well in advance and sometimes attract thousands of people. Do you expect to ban these types of large events for the remainder of the year? Should promoters with shows planned for the summer or the fall keep on planning, or would you urge them to cancel or postpone their events?
Well, again, we haven't made decisions about what things would be like in the green zone. Certainly, those type of large gatherings would not be permitted in yellow zones. But we remain concerned, of course, about the spread of this very contagious and dangerous virus, COVID-19. And very large gatherings certainly pose a risk. But I have no specific recommendations at this time, but we are looking at that.
From WBRE, Carbon and Columbia counties stated they are planning to move into yellow with or without the governor and the Department of Health's okay. What would you say to those county officials that are making that move?
Well, I have certainly no political response to the counties and the county commissioners. I'll leave that to the governor. Certainly, we want counties to be able to work with us at the Department of Health and the governor's administration in terms of our moving counties from red to yellow. And so we want to collaborate with counties in terms of doing that, and strongly recommend that they follow the governor's guidance.
Also from WBRE, would you or the governor consider moving part of a county from red to yellow? There is an idea floating around in Luzerne County that all but Hazleton could go yellow. What are your thoughts?
There are no plans to get beyond the county level in terms of granularity. We have no plans to go to the zip code level or anything like that. We're going to continue at the county level.
From Fox 43, today some Republican lawmakers joined together in support of a barbershop owner in Cumberland County who received a warning from the state for reopening against the governor's orders. What is your message to other business owners who are considering going against the governor's orders? And from a health perspective, why do you believe places like Cumberland County need to stay in the red phase right now?
Well, we're looking at all of our county data, our metrics, and our modeling right now. I have no comment about that specific situation. But we've said before that we have significant concerns in the yellow zone in terms of hands-on service activities such as barbers and hairdressers, such as massage therapists, etc. It is impossible to practice social distancing if the very important act of performing the service is going to involve hands-on activities such as cutting hair and styling hair and performing massage therapy. So that is why in the yellow zones we're not opening those businesses.
From the Tribune Review, I know it has been addressed before, but for the sake of clarity for our readers, can you speak as to why contact tracing is important and why it shouldn't be viewed as Big Brother is watching?
Oh, no. This is a very, very well-established public health activity. So if someone tests positive for COVID-19, then they go into isolation until they have followed the CDC guidelines in terms of when they're able to leave isolation in terms of their symptoms and how long it's been from the first time that they had symptoms and were diagnosed. Then we will do a case investigation. We will contact that person and we'll be talking about their symptoms, the timing of their symptoms, demographic information, and then who their contacts might be. Then we will contact the contacts, that's the contact tracing, tell them anonymously, meaning that we don't talk about which person they've been in contact with, but that they have been in contact with someone with COVID-19. We will verify all that information, and then they would go into quarantine for 2 weeks. If they develop symptoms, then they will be tested, etc. And so we do this with other diseases. It's just not as widely discussed, but given the ramifications and the extent of this global pandemic, it's become even more important.
From the Pocono Record, several district attorneys across the state have gone on record in opposition to punishing business owners who open their businesses in defiance of Governor Wolf's closure orders instead of waiting for their county to be cleared for reopening. What would you advise to law enforcement and business owners that might participate in such actions?
Well, my recommendation, of course, from a public health perspective, is to follow the governor's guidance in terms of counties that go from red to yellow and the businesses in those counties. I have no comment in terms of district attorneys or law enforcement. I will leave that to the governor.
From News Talk 104.1, Lycoming County Commissioner Scott Metzger outlined the daily DOH numbers on Tuesday and said by focusing on positive cases, it equated to spreading fear. What is your response?
Well, all along, we have not tried to spread fear. We have really tried very hard to give accurate and in a calm way the information about COVID-19 and the numbers. We have tried to be transparent, and we are working every day to try to be more transparent and to give out more information so that the public is informed. We do realize that the recovery rate, the numbers of recovered patients is important, so we're going to try to give you an estimate of that, and hopefully we can have that for you next week. But none of what we're trying to do is to instill fear. We're actually trying to have people stay calm, but to be informed and then make the right decisions in terms of social distancing, hand washing, mask wearing, etc.
From the Philadelphia Inquirer, the Bucks County Commissioner said they were told by state officials that they are rapidly approaching the yellow phase. Is that how you would classify where Bucks County is? And does that apply to the rest of the Philadelphia region, given their new case counts are high above the state threshold?
Well, you can see the numbers, and so we're pleased to collaborate with the Buck County Commissioners and their county health department, as well as all of the officials, as well as health officials in the southeast. We're looking at all of our numbers now, and we'll be considering which other counties might go from red to yellow.
The Philadelphia Inquirer's last part of the question, are you still using the same reopening metric?
Well, there's not one metric, and we've emphasized this very, very frequently. The 50 per 100,000 metric is over 14 days, is one thing that we're looking at. It's called an incidence rate, and so we're looking at that carefully. But we're also looking at other modeling, other types of data, and those are the quantitative measures. And then we're working, of course, on qualitative, more subjective decisions as well. And then we will present our findings to the governor. The governor makes his decisions about which counties go from red to yellow.
From WQKY, yesterday the Pennsylvania Dental Hygienists Association notified dental offices that cleanings and other routine procedures should not be performed. But on May 8th, the Pennsylvania Department of Health approved such procedures. Which directive should dentist offices follow?
Well, so dentists should follow our guidance that we put out last week. It's important for people who need dental care to deal with acute, maybe not emergency issues, but acute issues. That might be having a crown placed, or there are many different procedures, and to have access to that. Our dental guidance release last week made that really clear. The CDC has also put out dental guidance, and specifically it mentions, and our guidance mentions, that routine cleanings can be delayed until it's safe.
From WTAE, do you have a message for organizers of big events such as the Kenny Chesney concert, which is still scheduled for the end of this month at Heinz Field in Pittsburgh?
My recommendation is not to have large events in yellow zones. So Pittsburgh, Allegheny County will go from red to yellow tomorrow, and it's still not recommended to have large gatherings like that. You're going to have many people. COVID-19 is still in the community. Many people, as we know, are asymptomatic and might be carrying the virus, and we would worry about the community spread in that type of setting.
From the Morning Call, infectious disease specialist at two top health systems in the Lehigh Valley, Dr. Luther Rhodes of Lehigh Valley Health Network and Dr. Jeffrey Jarr of St. Luke's, said in recorded public forums they believe more that the Lehigh-Northampton region could and should be more open than it is now. In fact, to quote Dr. Rhodes, we should be in the yellow headed towards green. Have you talked to these specialists, and how do you respond to Dr. Rhodes?
So we have conversations scheduled with those experts.
From WJAC, Huntington County has had a high percentage of its reported cases coming from an outbreak at the state correctional institution, and the number of cases in the general population is similar to counties moving to the yellow phase this Friday. Would the Department of Health consider reporting inmate cases separate from cases in the community, as suggested by some lawmakers? How do inmate cases weigh into the decision of reopening a county, given that those cases are contained in facilities outside of society?
We've said all along that facilities such as correctional facilities, whether they're state correctional or county correctional facilities, as well as long-term care living centers, as well as, for instance, food manufacturers or processors, are all part of the community. And the staff go back and forth in the community. And it's not only the staff that have been tested positive who would now be in isolation, but also other staff that go back and forth. And remember, people can be asymptomatic or very mildly symptomatic and still carry the virus and still spread the virus. And so all of those facilities will continue to count in terms of county numbers.
From WTAE, renowned pathologist Dr. Cyril Wecht wrote in a Pittsburgh newspaper today, quote, "The overall restrictive measures that have been imposed are simply unsustainable." Do you have any response for Dr. Wecht today?
Well, I don't know of those specific comments, but we have taken all along a very moderate, phased approach in terms of how the different counties in the states closed, and they went from to what would now be red with the stay-at-home orders and the closure of non-essential businesses, as well as the closure of schools for this school year. Now that many areas have decreased rates of and incidence rates of COVID-19, we are taking that same phased, measured approach in terms of quote-unquote reopening counties in Pennsylvania, and that means going from red to yellow and eventually from yellow to green, and we're continuing that approach. So I think we've been extremely careful and moderate, but consistent throughout this process.
From the Pittsburgh Post-Gazette, do you think the role of temp agencies in staffing nursing homes has played a role in the spread of COVID-19 in nursing homes?
Well, whenever you have, the staff, first I'd like to say the staff in the nursing homes have been doing an absolutely fantastic job and have been trying so hard under very, very challenging circumstances in congregate settings with seniors, with elderly patients, many with comorbidities and other medical problems. So, they are on the front line, and they've been doing really a great job. But whenever anybody enters in a nursing home from the community, they potentially can spread COVID-19 because they could be asymptomatic carriers. It's not their fault. And so I don't think that temp agencies have played any other role besides that whenever you have people going in and out of the facilities, COVID-19 could spread. But sometimes those have been absolutely necessary in terms of staffing of those facilities.
From the Times Leader, have you received any updates on whether Pennsylvania has any cases of the childhood inflammatory condition believed to be linked to coronavirus? Some maps on national media are showing Pennsylvania has case or cases.
We're making those calls to the 6 fantastic children's hospitals in Pennsylvania today, and I hope to have more information tomorrow.
From the Scranton Times-Tribune, why are there nursing home cases reported in only 45 of the state's 67 counties?
I'm not sure I have a specific answer. I don't have that map in my head. There are certainly counties that have had more cases in the community. Staff lives in the community. People who might be asymptomatic, as I said, are working in nursing homes, and that's how you can start to have community spread within the home. So I have to look at the granularity of that data.
From the public source, do you think the country has an adequate system in place to distribute a COVID-19 vaccine once it's available?
I think that it'll be a challenge. So we're going to be working within Pennsylvania, and I'm sure within the nation, for the distribution of that vaccine. Of course, physicians and other healthcare personnel give vaccines regularly. Our fantastic federally qualified health centers give vaccines. In fact, vaccines are given under the Children's Vaccine for Children Act at our county, at our health centers in the counties, as well as in the county municipal health centers. But in terms of giving a vaccination program for the population at large, it'll be something that we'll need to work on when that vaccine is available. And we're going to be working on that now.
From the Philadelphia Inquirer, regarding your vaccination comments, do you know how many children have missed vaccinations during this time, and what are you hearing from pediatricians?
I'm hearing from pediatricians, and there was a report from the American Academy of Pediatrics in the journal Pediatrics about missed opportunities for vaccines because of COVID-19. I don't have specific information about that in Pennsylvania, but we know that during the stay-at-home orders, et cetera, that people have not been going to the well child visits, and that's why we made our specific comments today. We've had ongoing discussions with the Pennsylvania chapter of the American Academy of Pediatrics. I believe there was a conversation with our staff and the AAP this week. We're all strong partners and collaborate with them all the time, and we want to make sure that children get the necessary immunizations that they need to stay healthy.
From Lehigh Valley Live, Governor Murphy announced today that Jersey Shore beaches will open in time for Memorial Day. Is it safe to go to the beach, and what advice do you have for beachgoers?
Well, I have no comment to the governor's announcement in New Jersey. I would be concerned about traveling into other states that have, any other state that has a significant amount of community spread of COVID-19, and certainly being in a public setting. My recommendation would be if people do go there to practice social distancing, to wear a mask, to wash their hands, and take all of the precautions that we talk about every day.
Those are all of the questions that have been submitted for today's press conference. Thank you, Dr. Levine. Our next briefing will be tomorrow.